My name's DeSchaaf, and I'm a doctor of physical therapy and owner of SheFit PT in San Diego, California. Today I just want to talk to you a little bit about what physical therapy is, and in particular what I do here at SheFit. Now, a lot of people think of physical therapy as something that you get in the hospital or after surgery, where someone comes and makes you do exercises, or maybe you've been into a clinic for a sports injury or a work-related injury, where a PT had you do exercises, maybe some massage, a little bit of ultrasound and electrical stimulation. A lot of people still don't know the difference between a physical therapist and a personal trainer or an athletic trainer. So I want to break that down for you a little bit. A physical therapist is a licensed healthcare provider who has either a master's or a doctorate degree, as well as a state board license. And we are experts in the musculoskeletal system, the nervous system, in biomechanics, in exercise, and in movement. And we use that knowledge to help patients overcome pain, injury, inflammation, and eventually return to the activities that they enjoy. So if you have an injury that impacts your muscles, your bones, your joints, or your nervous system, that's something that a physical therapist can very likely help with. As a licensed physical therapist, I can help you with that shoulder pain, knee pain, sciatica, postural problem, any of those things that impact the systems we just discussed. Whether it's a recent strain, recovering from a surgery, or a chronic pain issue. Now I'd like to give you a little bit of an idea of what I do here at SheFit, which is a little bit more specialized and unique. I'm actually a women's health physical therapist. So I specialize in treating pregnancy-related conditions, postpartum conditions, and other conditions that impact women specifically, or women in a little bit different way, including urinary incontinence, pelvic organ prolapse, and certain pain conditions that impact the pelvic region and the genital region. Most of the women that come in to see me during pregnancy are coming in for low back pain, hip pain, neck pain, headaches, sciatica, all those little aches and pains that come up during pregnancy. A lot of the women also come in for guidance on exercise because there's still a lot of anxiety associated with exercise during pregnancy. Women don't know whether it's safe, they don't know how much to do, they don't know what types of exercise they should do, so I can help you do all of that. It's something that I'm very passionate about. I feel that women need to stay healthy and fit and strong during pregnancy to prepare for labor and delivery, and I want to empower you to be able to do that. Now, after the baby comes, the things I see moms the most for are, again, a little bit of urinary leakage, which is very common, as well as something called diastasis recti abdominis, which is that annoying split in your abdominal muscles, or the bulge that comes out in your tummy after pregnancy. Some of the other things I see moms for postpartum include pain with sexual activity, organ prolapse, and again, returning safely to the exercise or sports that they enjoy. Now, for you moms who have not had children or maybe far removed from your childbearing years, a lot of these issues can crop up later in life, especially if you've had a hysterectomy or you've been through menopause. And I want to encourage you that you're still able to treat these issues through physical therapy in most cases, although it might take a little bit longer, be a little bit more complicated than when you were in your 20s and 30s. In fact, 1 in 4 women actually have urinary incontinence or some form of pelvic floor disorder at some point in their lives. Now, I do want to mention that even though physical therapy has been shown in the research to be highly effective to treat all of these conditions, a lot of women still will not receive a prescription for physical therapy from their doctor or physician. That doesn't mean you can't come into therapy. I'm happy to see you without a prescription, and if a prescription is required, I will help you coordinate with your physician to get that. Now, I could talk for another hour about all of these specific conditions, but I'm going to cut myself off there and refer you to my website for more detailed information at www.shefitpt.com. You can also look at my Facebook page, which has a lot of additional videos and articles for your reference. And most of all, I'd like to encourage you, if you think you might have any of these conditions, to go ahead and give me a call or contact me and come in for an appointment so that we can get you started on the road to recovery. Thanks so much for listening, and I look forward to serving you here at SheFit.